Happen, the health and attainment of pupils in a primary education network, is based in the Faculty of Medicine, Health and Life Science at Swansea University and began as a local public health project in Swansea. Happen is a primary school network that brings together researchers from health and education with schools. It is part of the National Centre for Population Health and Wellbeing Research, funded by Health and Care Research Wales. Through my ESRC-funded PhD, I have been working to expand Happen as a collaborative network of health, education and research professionals across Wales. By working with schools to implement a Happen survey and action plan, my research enabled and empowered more schools to make evidence-based changes to their school community and to improve the health and well-being of their pupils. During my PhD, I further developed Happen to offer a meaningful framework for schools in Wales who have been tasked with the design and development of their own curriculum by the Welsh Government. One of the 6 areas of learning and experience in Wales's new curriculum is health and well-being. My research aimed to capture specifically child health information such as nutrition, physical activity, sleep and well-being. I linked this to administrative educational attainment data and health records, which I accessed through the ESRC-funded SAIL databank, working with the Administrative Data Research Centre. The Happen survey is completed by pupils and shared with schools as a school report. The results can then be used to give schools a better understanding of pupils' physical, psychological, social and emotional health, helping schools to make meaningful changes and to develop their new curriculum aligned to their pupils' health and well-being needs. I also developed Happen as a platform to evaluate school-based programmes, including outdoor learning and the Daily Mile.
Emily's support and work with us on the Happen survey has been invaluable. She turned the findings from the survey into a meaningful and tailored action plan to benefit children, and we use the survey each year to feed into our school development plan and to plan our curriculum using data from our pupils' health and well-being. As a school, we also took part in Emily's evaluation of outdoor learning, which helped support the implementation of our outdoor schools policy effectively. This resulted in the school gaining an excellent judgment from ESTIN, the School Inspectorate, for well-being and attitudes to learning.
It's fresher and I've got more space to learn, really, and it's less stressful because I can have some space to myself if I need it.
Over 20,000 children have now shared perspectives on health and well-being through the Happen survey. And over 400 primary schools in Wales now receive a school report tailored to their pupils' health and well-being needs. The next stage in my work with Happen is to address the challenges during COVID through the award of an ESRC postdoctoral fellowship. I am also working with over 40 countries on an international study to examine the impacts of the pandemic on head teachers and school leaders across Wales and the UK.